See some tips and points of Nclex RN. This video is related to the significance, patient preparation and nursing implications of diagnostic studies of the reproductive system. Let's move to the video. The first study is mammography. Mammography shows areas of concerns of breast cancer that may require further imaging and biopsies. The patient preparation include instructing the patient to avoid the use of cream, deodorant and lotions. The nursing implications are inform the patient that the results may not be available for a few days. The second diagnostic study is ultrasound. Ultrasound may show tumors, abscess, thickened endometrial stripes and congenital anomalies. Ultrasound may also be used to assess breast tissue and guide a biopsy if an abnormality is detected on a mammogram. In men, ultrasound may detect tumors or abnormal tissues in the scrotum. The patient preparation includes a full bladder may be required for this test if assessing the female pelvis. Undress from the waist down. If a transvaginal approach is to be used, explain how the probe will be inserted in the vagina. The nursing implications inform the patient that results are usually available within hours of the testing. However, the practitioner will have to review them before a management decision is made. Third diagnostic study is magnetic resonance imaging. This shows anatomical anomalies, tumors, abscess, inflammation, atrophy, bleeding or hemorrhage. The patient preparation include explain to the patient that this test requires that the patient lie still while the images are taken. It may also require administration of IV contrast. Remove all jewelry. Assess pregnancy status. The nursing implications are inquire about implanted metal in the body which may prevent the patient from participating in the study. Assess for claustrophobia. Provide supportive care. Confirm allergies before administering contrast. Fourth one is colposcopy. This is a diagnostic study which shows precancerous cells, human papilloma virus related changes of the cervix. The patient preparation include encourage the patient to empty her bladder. Patient should avoid placing anything in the vagina for at least 24 hours before the procedure. If the patient is menstruating, the procedure may need to be rescheduled because heavy bleeding makes visualization of the cervix and vaginal mucosa difficult. Assess pregnancy status prior to the procedure. The nursing implications are informed consent must be signed before the procedure. Confirm patient's allergy. Lugol solution is contraindicated in patients with an iodine or shellfish allergy. Recognize that the patient may be anxious regarding the procedure and may have additional questions before and after the procedure. Provide adequate pain medication after the procedure. Review post-procedure expectations along with signs and symptoms that may require further evaluation. Next is laparoscopy. Laparoscopy shows possible pathology, ovarian cyst, fibroids, endometriosis, tubal abscess. The patient preparation include NPO the night before surgery, prepare the surgical site for the procedure, confirm right site, right patient and right procedure, assess pregnancy status prior to procedure. The nursing implications are ensure patient understands the surgical procedure, informed consent must be signed before the procedure, ensure patient understands anesthesia and pain control methods. Discharge teaching should include at least 2 days of rest post-operatively. The risk of bloating and abdominal pain should be discussed with the patient as the result of the instillations of carbon dioxide into the abdomen. Next diagnostic study is hysteroscopy. Hysteroscopy uses direct visualization of the endometrial cavity, allows surgical removal of fibroids and polyps that are in the cavity. The patient preparation include NPO the night before surgery, prepare the surgical site for the procedure, confirm right site, right patient and right procedure, assess pregnancy status prior to procedure. The nursing implications: ensure patient understands surgical procedure, informed consent must be signed before the procedure, discharge teaching should include at least 2 days of rest post-operatively, nothing in vagina for 4 weeks after the procedure. Next is dilation and curettage, DNC. DNC can assess for molar pregnancy when what should have been fetal tissue becomes the abnormal growth in the uterus, endometrial cancer and other abnormalities of the endometrial lining. The patient preparation include NPO the night before surgery, prepare the surgical site for the procedure, confirm right site, right patient and right procedure, assess pregnancy status prior to the procedure. The nursing implications include ensure patient understands the surgical procedure, informed consent must be obtained, discuss normal postoperative bleeding, that is the pad counts. The patient may experience cramping that should respond to non-steroidal anti-inflammatory drugs. Next is hysterosalpingiogram. It may reveal blocked or dilated fallopian tubes or abnormalities in the uterine cavity. The patient preparation include assess pregnancy status prior to the procedure. The nursing implications are ensure patient understands the procedure, assess allergies to iodine and other contrast materials, informed consent must be obtained, explain that some cramping and vaginal bleeding may occur after the procedure. Cramping should respond to non-steroidal anti-inflammatory drugs. Next is endometrial biopsy, which assesses for possible endometrial cancer or endometritis. Patient preparation: assess pregnancy status prior to the procedure, and the nursing implication include ensure patient understands the procedure, informed consent must be obtained, explain that some cramping and vaginal bleeding may occur after the procedure. Cramping should respond to non-steroidal anti-inflammatory drugs. Hope you understood this video. Keep to follow for more tips and points on Nclex RN. Thank you.